This report tutorial is to assist you with your interpretation of your dried urine test for comprehensive hormones when the patients are on topical supplementation of progesterone. And this is a particularly tricky scenario. Urine values of progesterone metabolites may be an underestimation of tissue levels when you're on topical progesterone. There is a longer video that discusses this at length and discusses salivary results, which go up very, very high when you're on topical progesterone, as well as discusses serum results and urine results. Here we just want to help you understand how to interpret the results appropriately when the patient is on topical progesterone. So when we're looking at progesterone, we've got two metabolites that we're looking at, the beta metabolite and the alpha metabolite. These are going to track reasonably well with systemic levels of progesterone, serum levels of progesterone, and the situation you see here in the upper left is what you'll see for a postmenopausal woman typically. So as you can see from the key on the right, between the stars is the premenopausal range when the woman is ovulating, which helps her make a lot of progesterone, and the little purple band, which this patient is within, is the postmenopausal range. So if you're taking topical progesterone and you end up getting these sort of postmenopausal levels of progesterone, it's not unusual because progesterone, when it's taken topically, and we mean transdermally on the skin with a cream, it doesn't tend to raise those levels very much. So when you take transdermal progesterone and you push a woman's progesterone into the lower end of the premenopausal range, usually it'll take more than 100 milligrams of topical progesterone to get the woman up into those levels. And many people would say that there is a clinical effect from topical progesterone at those lower doses, 20 milligrams, 30 milligrams. However, they do not really raise the urinary levels much. So you have to take that into consideration when you are interpreting the results. So if you end up pushing a woman into the upper end of the premenopausal range, a woman who's postmenopausal who would have begun way down here, it can take a very, very large dose. Now, caveats to that, alcoholic gels sometimes will push those urine and serum levels up a little bit easier, but most of the time you're not going to see these sorts of levels with with transdermal progesterone, and you certainly don't see very high levels of progesterone. So with a postmenopausal woman, if you see these higher levels, you first need to make sure that she's not actually ovulating still, because that could be the reason for the progesterone. Secondly, if she's concurrently taking progesterone sublingually or orally, that can be the cause of those. That's more likely from that than the transdermal progesterone. Also, make sure you check on oral pregnenolone, which can also increase progesterone metabolites. Now, the one case where you can really take advantage of this lack of increase in urine is with a premenopausal woman. If you put her on, let's say, 20 milligrams, 30 milligrams of transdermal progesterone, and you get these sorts of values in the urine, it's likely a very good reflection of her endogenous production of progesterone. So you can still examine the endogenous progesterone production while they're on low-dose progesterone therapy transdermally, but we need to put that into proper context when we're trying to make sense of topical progesterone when we're looking at the dried urine test for comprehensive hormones. And again, if this is sort of a new concept to you, I would encourage you to watch the larger video on topical hormones that'll walk through the data and explain what to expect to see with saliva testing, with blood testing, and with urine testing with topical progesterone and other hormones, which is a fairly complex scenario.